Hello, everyone, and welcome. Thank you for joining us today for this important discussion on social stigma and COVID-19, protecting your workers. We're having an interview with Dr. Keith Dobson today, who I will introduce very shortly. The topic of civility and respect is quite closely correlated with the workplace factor of psychological protection. They meet similar human needs. And when these factors are compromised, it can result in significant stress and can have a tremendous impact on the energy level of an individual, of a team, and of the entire organization. It's important to maintain an environment of civility and respect and psychological protection to protect the mental health and lower the risk of psychological and physical harm that can occur. The risk involved when civility and respect and psychological protection are compromised in the workplace is greater when we're dealing with a situation where workers feel the negative impacts of the work environment, which is what we're dealing with when workers don't feel safe in their environment. It affects them psychologically. Fear, anger, stigma, these can all occur, and this can put people at greater risk of psychological and physical harm. As we attempt to navigate through working and living with COVID-19, we need to have a clear understanding of the social stigma and the harassment that can affect people as they strive to cope with this new reality. So I'd like to introduce Dr. Keith Dobson. Dr. Dobson is a professor of clinical psychology at the University of Calgary in Canada, where he has also served in other roles, including head of psychology and director of the clinical psychology program. His research has focused on both cognitive models and mechanisms in depression and the treatment of depression, particularly using cognitive behavioral therapies. A current focus of his work is on prediction and prevention of relapse in depression. Dr. Dobson's research has resulted in over 280 published articles and 80 chapters, 15 books, and numerous conference and workshop presentations in many countries, and he is the recipient of many distinguished awards. Dr. Dobson is also a principal investigator for the Opening Minds program of the Mental Health Commission of Canada, with a focus on stigma reduction related to mental disorders in the workplace. Welcome, Dr. Dobson. We're so pleased to have you here today.
Well, thank you for having me, and thanks for focusing on this important topic today.
Okay, so let's dive in. We're hearing more and more about rising incidents of incivility, disrespect, and aggression since the COVID-19 pandemic took the world by storm. Is this a result of cabin fever, or do you think there's something more to it?
Yeah, I think it's definitely more than just cabin fever, unfortunately. In fact, there are studies that have looked at past pandemics that have come out recently, and they've identified stigma and negative attitudes towards people that are associated with the pandemic as part of the normal process, if you want to think about it like that, of a pandemic issue.
Mm-hmm. Mm-hmm. So what kinds of behaviors is this, do we see happening?
Yeah, so we can see a whole wide range of behaviors. And in fact, one of the themes I guess I'd like to point out today is that a lot of what I'm going to talk about can be seen on a spectrum, from relatively mild kinds of incidences through relatively severe issues, even potentially dangerous issues. But some of the kinds of things that we see as responses include microaggressions, what we would call that. So these might be very subtle things like, looking at somebody in a negative way, or, flipping your hand and dismissing someone, walking away, not interacting with someone. So these would be sort of subtle kinds of microaggressions. Mm-hmm. Could range through more severe kinds of things like avoiding certain people. For example, if you go into a store and you purposely avoid people that you might unconsciously or consciously associate with the pandemic, so to engaging in that kind of behavior, shunning them or not responding to people if they talk to you, if you associate them with the pandemic. And then even more extreme behaviors like shouting. I've heard of incidents of people spitting at others, which of course is getting quite aggressive, or even becoming more violent. So again, there's a range of responses that are possible.
Mm-hmm. And would you say that this is something that's maybe coming out of like mental health issues that are, is it the isolation and the quarantine that's affecting people's mental health that's maybe causing them to act this way?
Well, I think it's partly that. I mean, again, part of the response, and we've all been encouraged, of course, to do physical distancing, to stay home. So I think people are naturally feeling eager and desiring to get back out into the real world, so to speak. And so I think, there is that sort of, anxiety again about going out and potentially contacting. We also know, of course, that the pandemic is not at all over. So there still is a risk when one leaves the home. So I think people are feeling somewhat anxious and keyed up, and again, there's a kind of a normal process that goes on when people feel anxious, that they start to look around in their environment and look for threats. And if you see someone or something that you think could potentially be a threat, it's normal, again, to start to focus your attention on that object. Or that person, as the case may be, and to start to become more worried about what they're doing or saying, and to either want to, again, depending on the situation, have one of several different responses. In anxiety situations, we talk about the fight, flight, or freeze response. So the fight response would be to become aggressive and to interact in a way that's hostile and rejecting of the person. Flight would be to avoid or get away, if possible, or just freeze and say nothing. So again, these would be the typical kinds of responses we'd be looking at, but it would depend on the situation, and it would depend partly on the individual themselves, of course.
Mm-hmm, mm-hmm. And when it comes to these individual kinds of situations, I mean, we're hearing concerning reports that people from certain ethnic backgrounds, in particular East Asians, are really experiencing a lot of incivility and harassment because of something called xenophobia. This is kind of a new term for a lot of people. Can you explain what that is and why it happens?
Sure. There's kind of a convention in psychiatry and psychology to name fears and phobias with Greek words. And xenophobia is a Greek word. Xeno itself literally means stranger or guest. It was used in different contexts in Greece. But xenophobia then is fear of a stranger or fear of a guest. But in this context, we think about it as fear of strangers. And in the current pandemic, of course, because it's been associated with Asia, and in particular China, people of Chinese and generally Asian descent have been the victims of some of the xenophobic thoughts, fears, and actions that we've been seeing. But all phobias are, from the Greek word. So again, we have many of them, but I won't name them because there are hundreds, literally.
Yeah. So if somebody is expressing this kind of fear or this kind of behavior, does it mean that they've always been a racist?
Not at all. No. In fact, we know that phobias can be learned and phobias can be unlearned, that they can come and go, depending on different kinds of circumstances or situations that a person is feeling as well. And of course, the major thing that we do to try to treat people with phobias in the psychological treatment field is to expose them to the thing that they're afraid of. And through the process of exposure, generally speaking, people can actually learn that the thing that they were afraid of is not dangerous, that their reaction is undue or is over the top in some ways. And they can therefore learn that they can have a more realistic appraisal of the thing that they were afraid of and interact in a more appropriate way. So I'll just give you an example. Somebody who has claustrophobia, which is the fear of being in tighter, closed places. The typical treatment would be to, over a period of time, at a pace that they're ready, expose them to being in closed places or spaces that are dark, so that they can learn that it's not dangerous and they don't need to have the fight, flight, or freeze response.
Mm-hmm. So this can be a little bit challenging when we're talking about exposure to other people, especially during a pandemic when we're trying to be socially isolated and physically distanced, and we're in our bubbles. So what effect does that have on this?
Yeah, no, absolutely. I think you're right that it's extremely challenging. And partly also when you leave the home and you go out into social circumstances, generally you can't control who you're going to come into interaction with. So you might be in a shopping mall, for example, and suddenly be confronted with the situation that you are afraid of. And so again, we lose a degree of control. So I think it is absolutely challenging. I think, again, for people that are leaving the home and, going into shopping centers or going to the grocery store, and encountering different people, I think one of the things that we all need to do is be prepared for these interactions, psychologically, that is, be ready that, we are going to give up some degree of control when we leave the home, to check our thoughts, to make sure that we're comfortable with what we're doing, and that if we have different kinds of social encounters, we're not going to overreact, potentially. If we feel uncomfortable, probably the best thing to do is to quietly exit the place, rather than engaging in any kind of negative interaction or creating a scene in some way. And then when you're comfortable, go back and actually re-encounter the person. So again, at a pace you're ready and willing and able, have those kinds of social interactions with a range of people and discover that it's not dangerous.
Okay. When you and I talked previously, you were also mentioning about confirmatory bias and how that feeds into the issue too. Can you talk a little bit about that?
Yeah. Again, this is a normal psychological process. Once we're afraid of something, or once we have some kind of an issue with whatever the object is, there are some normal psychological processes that tend to kick in. One of them is confirmatory bias. This is also related to another process we call selective attention. So basically what we do is, once we see something as fearful, we start to focus on it. We start to pay selective attention to it, and we look for information that confirms our previous ideas. So if, for example, we're developing negative attitudes about a particular type of person, we look for information about them that fits our bias and actually would confirm, again, this is the confirmatory bias that we engage in to confirm our ideas are valid. And this is a normal thing that we do all the time. In fact, in the psychological literature, there's a lot that's been written about what we call cognitive heuristics. Heuristics are basically shorthand conventions or rules that we adopt to manage the complex world that we live in. Like, there's just too much information in the world, on a day-to-day kind of a basis. So we develop these kind of shorthand rules or ways of thinking about things that let us manage more conveniently or more quickly. And so confirmatory biases is one of these kinds of things that we do. The other thing that we do is we tend to have selective memories. So, even after leaving a situation, not only do we attend to things that we think about in the situation, but when we come back out of it and we're trying to remember the situation, we tend to remember those things that fit our pre-existing biases. So we get into this kind of self-confirmatory loop where what we are looking for confirms our bias, and what we remember also confirms our bias, and it can become a kind of a vicious cycle.
Yeah, I can see how that would be a dangerous road to go down.
Sure, but it's very normal. We all do this. For example, if you're a very outgoing, sociable person and you get invited to a social invitation on a weekend, you probably will say, sure, I'm happy to come, and you'll go and have a good time. If you're somebody who sees yourself as socially anxious, you probably would reject the invitation in the first place and sit home alone on the weekend and, confirm your bias about yourself as being socially undesirable or unpleasant. Or if you go, you might stay for a short period of time, and then you'll probably remember it as a more negative interaction. So we construct our world around ourselves in ways that confirm the kind of person that we think we are.
That's very interesting. And with respect to the targets of this kind of behavior, it's not just people of East Asian descent. This kind of behavior can occur, like you mentioned, that it's a normal reaction. We're trying to our brain is really trying to protect us from what it sees as a threat to us, or even our family, right? Our loved ones.
Absolutely.
And it can be, there's other groups of people who may be targets of this kind of behavior too. Can you talk about that a little bit?
Surely, yeah. So one of the things, again, that's been well observed in fears and phobias is what we call generalization. So, it's not at all unusual for a person to start with a particular kind of a fear, and then they will quickly start to scan, again, look around and find other things that are similar, close enough that it becomes encompassed in that kind of threat. So it's not just people from China, for example, in the current pandemic that have been victimized, but, people generally of Southeast Asian descent have been victimized, even if they've never been to China. Many people in Canada, of course, are born and have lived here their entire life. lives. And so we start to see overgeneralization of fear. And then it can even get spread even more. So for example, if you think about people in the workplace, once you start to have a fear about, people that are in the workplace itself generally, you can start to see a generalized fear that it develops, or workers in general. For, again, people that leave their home, and if they're shopping, you might see everybody who works in the grocery store that you go to as a fearful kind of object. And these are all processes of generalization.
Mm-hmm, mm-hmm. And that's pretty much what led to doing this seminar, this webinar in the first place, where the rising reports of people who are working in frontline grocery, for example, who have been victims of harassment and abuse and just terrible incivility. But I've also had discussions with people in healthcare who have experienced this kind of behavior, even from their coworkers who don't want to be around them for fear of taking it home to their loved ones as well.
No, exactly. I think what you're describing is exactly this process of generalization of fear to people in places that are probably not appropriate. Exactly right.
Yeah. And then I think also for certain segments of the population, for example, if someone is at higher risk of contracting the virus, or higher risk of more severe consequences,
Sure.
so those that are those that are over 60 years of age, or those who are immunocompromised.
That's right.
That can, it can become a situation where maybe you don't want to be around younger people, or people who you see as not really respecting the boundaries and things like that.
Exactly right. And in fact, in the anxiety literature, again, there's another way of looking at the risk factors for anxiety and fear. And there are three sort of general factors, psychological factors, that are implicated. One is unpredictability. So the extent to which you either know what's coming, and you can predict, what's dangerous about it, or it's unpredictable. And again, if you're heading out into the social world, there's a lot of unpredictability. You don't necessarily know what you're going to be facing. So not surprisingly, anxiety tends to go up. The second is controllability. So the extent to which you can control the environment or control your response to the environment. And again, when you're heading out into the world, you may or may not be able to do much. And realistically, with this pandemic, there's not much we can do in any event. We're all told to keep our hands clean, to keep our hands away from our mouths, to stay home or do physical distancing as much as possible. But these are pretty weak efforts in many respects with regard to the pandemic. And then the third is consequences, personal salience. And you're right. I think, people that have higher risk, for them, the salience or the potential importance of being out in the world are higher, because not necessarily that they're going to contract the virus more than other people, but the consequences can be more severe. And so, any of those three factors will drive anxiety up. And unfortunately, in the context of the COVID-19 pandemic, we have all three. We have a lot of unpredictability, uncontrollability, and a lot of personal salience, because we know people are becoming ill and even dying with the pandemic.
Right. And so when this behavior spills over into the workplace, it can really have some very serious detrimental effect on workers as well as the organization itself.
Yes.
And we know that when workers are overstressed, they may experience more difficulty both in their professional lives and their personal lives. What are the effects that you think are prevalent that could be, whether the person is a victim or whether they're an aggressor, whether they're a bystander?
Yeah. So I think first focus on the victim side. So again, if you're a worker in a work situation and you're the victim of somebody who comes in and it has xenophobic tendencies or just simply, aggressing against you, there's some fairly clear consequences. One, obviously, is you're going to feel a sense of fear yourself and anxiety about your safety, your personal safety. You may want to come to the workplace less, so you may be motivated to work less. You may, even if you're in the work situation, hide out a little bit or, sort of reduce your interactions with others. And in the worst case, of course, you might end up with incivility yourself. Or I suppose, theoretically, you could even be the victim of direct aggression, being spat upon, for example, or having negative comments hurled at you. These are not pleasant things for anybody, and they're going to have a psychological toll, without a doubt. So as a victim, there's very clear negative consequences. Worst case scenario, and I've heard of cases like this too, I could imagine people who just simply refuse to go into the workplace because they feel unsafe. And so that can, of course, have consequences, not just for them in terms of their income and their livelihood, but also for the employer, again, and the employment situation. For the aggressor, again, I think, in some ways the negative consequences are less, except, and this is really sort of a subtle kind of a thing, because you've aggressed against somebody, the natural tendency is to justify your behavior to yourself. And again, another psychological process we talk about is something called cognitive dissonance. Cognitive dissonance is a normal process that, again, we all go through, where we look at our own behavior and we justify it in terms of the way that we responded. So, for example, if I said something rude to you, my way of justifying that might be to say, well, you deserved it. So that this would be a way of reconciling that kind of cognitive dissonance. And again, in the context of the pandemic, if I'm going in and aggressing against other people, I'm probably going to justify that to myself by saying there's something about them that they deserved it. So maybe, again, they were Asian descent, or maybe, I think they weren't being careful enough, or maybe, again, there's lots of different ways I could justify that behavior. But it sort of excuses me and allows me to maintain my sort of position as being okay, but then other people are the victim, which again is not a healthy way of approaching the world, of course, because then that drives up your sense of threat and anxiety and allows you potentially to actually engage in more aggression towards others. Mm-hmm. So again, it's a negative consequence, I think, for the aggressor as well, in the sense that it allows them to justify their aggression and possibly repeat it in other contexts. So again, not healthy. For the employer, of course, this has huge consequences because it's negative for the employee. He or she is going to feel victimized again, won't want to be in the workplace, may actually stay home in some cases if it's extreme. For the person who's coming into the workplace situation, it's not a pleasant situation for them. So they don't particularly want to come into your workplace or your, if it's a store, for example, the people aren't going to want to do that. And of course, you have to deal with the direct effects of the aggression. And again, in some cases, this could include the sense that you as an employer are not protecting your employees. You might be actually having a dangerous workplace. And in the extreme, I suppose, could even lead to things like harassment complaints against the employer, or even more severe kind of civil liability.
Mm-hmm. Mm-hmm. And it affects the bystanders as well, people who are witnessing this kind of behavior. I mean, I've seen situations not directly related to xenophobia, but in general, when people are engaging in kind of aggressive or harassing behavior in the workplace, people who are witnessing it or bystander, they're almost feeling the such negative effects similar to what the victim is feeling, or the target, I should say. And they may feel helpless to do anything about it, although they may not. They may decide that I need to speak up, and there's certain right ways of doing that and wrong ways of doing that as well, right?
That's right. So, and I think you're right, exactly right. Sort of the typical responses are either to, flee or freeze, to say nothing, in which case, again, you could have shame and embarrassment as a bystander to stand there and watch something that's happening and not taking action. So, you might be embarrassed at yourself for not sticking up for the person that is having the aggression. Or you take a risk. If you stand up against an aggressor, you potentially could also become the victim of aggression. So again, for many people, it's easier in some ways just to step back, but it does lead to negative psychological consequences. And in any event, it's an unpleasant social interaction. And again, your likelihood of wanting to go back into that workplace is going to go down.
Yeah. So really, employers really need to be aware that this can really create a toxic work environment. It can have tremendous impacts on their workers and on their organization, their ability to get the work done and even succeed through the challenges that they're dealing with COVID. Mm-hmm. And so, I think we would suggest that they would look at really being clear in their communications on what the expectations are, what the boundaries of civility and respect are, and what's required for personal protection, and just really psychological protection, and upholding those policies and procedures and making sure that they follow through and hold people accountable for their behaviors.
Absolutely. Yeah, I think all of those. And again, I think, as an employer, again, one of the things that I would hope everybody is doing now, if they haven't already, is sort of doing an environmental scan of the workplace and look for those kinds of points of contact where these kinds of situations might emerge more likely. You could, for example, put up signage, to talk about the importance of respect in the workplace and that there's an intolerance for civil disrespect or improper conduct. So just sort of, give that communication. You can talk to your employees and let them know that you won't tolerate harassment or disrespect, and that you would ask them to report such incidents to you as a manager or as an employer so that you can deal with them directly. But I think, again, the one thing you already said, which is really critical, is this idea about open communication, to let people know that you don't want this to be silent or to sort of happen as microaggressions that don't get addressed, but you'd rather be able to know about them so that you can address them directly.
Mm-hmm, mm-hmm.
Yeah.
Now let's switch gears a little bit to someone who is perhaps already living with mental illness. I can imagine that the effect, whether that person is the target, whether they are the aggressor, whether they're the bystander, or maybe they're the manager or supervisor trying to deal with this thing. How can this kind of situation affect someone who's already living with mental health issues?
Yeah. So I think my answer here would be kind of, it depends. And I think it depends partly on the nature of the aggression, of course, who it's directed to, and the nature of the mental illness. So, for example, I've heard of some individuals who have had pre-existing social anxiety prior to the pandemic, who are actually feeling quite comfortable to stay home, and so they don't particularly mind the fact that they have to do physical distancing, and they're not that keen to return to the workplace, period. Or I've heard of some students who don't want to particularly return to school because, again, it's uncomfortable for them to begin with. So for them, I think just simply being in the environment is going to be a challenge and is going to be increased stress for them. And so looking for ways if you can accommodate or manage sort of the workload in some ways to help some people would be better. So that's one way of thinking about it. The other response I guess I would have is that in general, any kind of pre-existing stress or any kind of pre-existing condition, including mental illness, is just simply going to increase a person's susceptibility to other kinds of insults or other kinds of injuries. And so in general, I think, people going into the workplace, if they have a history of depression or, other kinds of conditions, their likelihood of having relapse, recurrence is going to go up, especially if it's a stressful work environment. And again, the possibility, again, of them having to leave the workplace, go on leave or disability, again, is going to be at increased risk. So again, to the extent that an employer can anticipate those kinds of situations, if they can have open, frank communication with employees who have a history of mental illness, to find out how they can best manage these kinds of situations, to me, those would be the best kinds of strategies for dealing with that kind of situation.
Mm-hmm. And with respect to the coping strategies that people would be using, and I would imagine that this kind of behavior would also affect the coping strategies they're using and have kind of a compounding effect. Is there even a risk of an increased risk of self-harm in these kinds of situations?
In the extreme, for sure. I mean, we know, for example, if we look at stigma, for example, we often, again, make a distinction between social stigma or stigma towards other people and self-stigma. And self-stigma is where people internalize some of the negative attitudes and beliefs about themselves. So, for example, in the workplace, we know of people with a history of depression who will self-handicap. They won't apply for a position promotion, even if they're perfectly eligible and they've got the skills skills and training because they see themselves in some way as being undeserving or unworthy of that promotion. So this is a self-handicapping or self-stigmatizing kind of attitude. So I could well imagine people, again, with the history of mental illness in the workplace, if they're the victim, again, of some kind of harassment or some kind of negative behavior from others, not taking the steps to protect themselves or bringing it forward to the employer because they feel that they don't deserve better, or that they don't know that necessarily they're going to get the kind of response that they want. So again, I think part of the job of an employer is to allow people with or without, frankly, a history of mental illness to feel comfortable and to feel valued and to feel that they're being protected in a way that they can come forward and raise these kinds of concerns.
Mm-hmm. Mm-hmm. So some advice for employers on how to deal with this kind of behavior. I've heard, we hear all the time, blaming and shaming really doesn't work. It tends to drive the behavior underground and make it even more insidious in some situations. So what's your advice on how to deal with this kind of behavior, and so that the way that we're dealing with it has a more positive impact?
Yeah. So here I think we can actually draw on some of the work that's been done before by the Mental Health Commission of Canada. There's an information sheet, for example, that talks about sort of a 3-stage response. In the program we have called the Working Mind, we talk about, again, another 3-stage response. We use different terminology for in the different programs, but it's basically the same 3 processes. The first is to acknowledge the feelings, and the issue, whatever's happened. So to name it, not to simply name and blame, but to say, this has happened, to help people to legitimize their feelings. So if they're feeling anxious or feeling worried or feeling harassed or victimized, to allow them to have those feelings and to let them know that. So, and one of our other things we talked about is shielding people. So, let them, again, feel safe in order to talk about these kinds of issues. The second is to provide information and to set boundaries. So, again, another one, we talk about sensing, or sort of being aware of and setting boundaries to help people to feel that they can, again, be safe in the environment. So getting information, reminding them about the steps that they can take, if they feel they're being victimized or harassed. And then the third is to take action, to support people, and to actually do the things that are necessary, potentially, even, confronting people that are in the workplace that are causing problems. Potentially, I suppose, as an employer, taking steps to remove people from the workplace. And even in the worst case scenario, I suppose, even calling police or, involving other people if the violence or the victimization is so extreme. But being ready for a range of responses that is going to show the employee that you really are going to support them throughout the process. And again, throughout all of this, open communication is critical. Letting people know what you're doing, why you're doing it, and being consistent in terms of the communications you're giving.
Mm-hmm. Excellent. Well, thank you so much. I think this has been really helpful and helps to really frame what it is that people are dealing with and why the behavior happens. And then also to know that it is normal behavior, so that not that it's acceptable behavior, but
Right.
It is normal. So want to really make that one clear. We're not endorsing the behavior.
Well, no, exactly. I mean, people are actually remarkably resilient, I find. And again, if you understand the psychological processes, you can probably understand why they're engaging in the behaviors they are and why they're saying and doing the things that they do. Doesn't necessarily justify it, like you say, but it is probably understandable.
Because it's all coming down to fear and self-preservation and just trying to make our way in this world. Well, thank you so much, Dr. Dobson. So I'd just like to close with a reminder to employers that addressing these kinds of issues proactively is absolutely the best. Don't just sit back and wait for people to come forward. I mean, that's one of the things that we tend to look at when we're looking at the reporting policies and things like that for harassment and incivility in the workplace. If we start with waiting for the person to come forward and report it, likely by the time they come forward, the damage may have already been done. So really take a proactive stance to that. Have a look at your policies and procedures. Have that open communication. Build this into your processes so that you have it in there as you're going forward, and utilize those great things that Dr. Dobson talked about. Remember that workers who are living with mental health conditions may need additional support. They may need, more one-on-one contact. They may need, a good, safe place to feel safe in coming forward and talking. They may need to be pointed to other resources that can help them with their coping skills and with their recovery, and helping them to stay within those healthy zones. And I'd like to also highlight that the return to work phenomenon, Keith, you and I talked about this the other day, the return to work phenomenon will look different for people across the country and in different jurisdictions and in different industries. And it's a fluid situation that might go in waves. And so focusing on that open communication, really understanding what people are actually dealing with is so important, and being open and honest about, even if you're sitting down with somebody to talk with them about what you're dealing with, acknowledging your own fears and concerns about the situation, correct?
Yeah, those are all great points. Absolutely. Yeah. I think the issue that you just mentioned too about the fact that this is going to be different in different parts of the country. Again, we were talking earlier about the fact that people of Asian descent may be particularly likely to be victim of xenophobia. And of course, the distribution of people with Asian descent varies across the country. So you might expect, these kinds of incidences to also, take place in different ways in different parts of the world, or Canada. Yeah.
Yeah, I could see that. So there are resources that are available to help employers. One of the Mental Health Commission has a COVID-19 resource hub. Please feel free to go on there and have a look for the resources that are there. One of the things that we know is raising the levels of stress among people are the financial concerns. And Dr. Dobson, yes. you already did a session on dealing with financial concerns. What's the title of that one again? I'm sorry.
Oh, gee, I don't remember. So I'm sorry.
Okay, that's okay.
But again, it's on the Resource Hub, I believe.
Yeah, it's on the Resource Hub, along with a lot of other really good resources. One of the resources, for example, is from the Canadian Centre for Occupational Health and Safety, who provided an excellent tip sheet on preventing stigma. And there's other resources on the hub as well. Another one that I'd like to mention that is I think particularly helpful in this kind of a situation is a tip sheet for talking to workers in crisis during COVID-19, because when somebody does come to you with these kinds of issues, they may be in a situation of crisis at that point. So that tip sheet can be very, very helpful as well.
Yeah, the other thing maybe I can also draw to people's attention is the mental health continuum model, because this is a framework for people to self-assess, if they want to, where they are on this continuum. And the continuum uses a color code of yellow, green, for good functioning, yellow, orange, and red functioning. So it's a spectrum of mental health challenges and concerns. But one of the nice things I think about the tool is that it allows you to also look at different areas of functioning. So, anxiety-related problems, stress, substance use, alcohol use, and so on, and look at where you are in terms of this spectrum of functioning. So you can use it as a self-assessment tool, or you can help employees, if you're in an employment situation, to also assess their own mental health functioning.
Mm-hmm. So it could help you with kind of seeing where your whole team is on the spectrum as well.
For sure.
Awesome. Excellent. Okay, well, thank you so much for your time, Dr. Dobson. And for all of you who have been watching, if you found this video helpful, please like it, share it, and let's work on getting ahead of this mental health curve. Thank you. Bye for now.
Thank you. Take care.